Now, using our 3 steps, let's break this down. This question is asking for priority patient report regarding the key problem. They're taking allopurinol. So allopurinol, we already know that it's given for gout and even possible treatment for kidney stones. So the solution we're looking for are findings that might indicate the worst potential outcome. Now, if you guys didn't know anything about allopurinol, guys, just look for the worst case scenario here, or really look for something that stands out in the options below. So option number 1 and 2 are incorrect here. Increased fluid intake is recommended with this medication, and is to be expected. Now, option 2, also incorrect. Nausea is a side effect, so we take after eating. Now, the tricky one here is option 3 and 4. So option 3 is our correct option here. So a red rash on the neck and the face may indicate a reaction. Technically, Stevens-Johnson syndrome is the worst reaction in terms of skin reaction. And option 4 is incorrect here, because acetaminophen, you can technically take it because there's really no liver involvement. So option 4, incorrect, and option 3 is the most correct. Okay, that wraps it up. For more details and test tips, please see our... Now, using our 3 steps, let's break this down. This question is asking for the priority findings for the key problem. You're taking methotrexate. So before looking at the options, we're just thinking methotrexate minimizes the immune system, which results in big risk for infections, and it's also given for chemo, so it really just kills off anything, or basically any cells that are the most rapid producing. So any type of blood cell or coagulation cell here. So the solution we're looking for are findings that indicate the worst potential outcome. So option 1, 2, and 3 are incorrect. Option 1, oral contraceptives presently are for females, and this option said it's a male patient. Now option 2 and 3, also incorrect. Ammonia levels are normal. And option 3, it's not recommended to drink energy drinks, but it's not the worst possible outcome. So option 4 and 5 are the worst possible outcomes. So option 4 is correct. Petechiae may indicate thrombocytopenia, basically a big bleed risk. Option 5, low platelet counts, again, huge risk for bleeding. So just think ABCs. C is our circulatory or circulation problem. Big risk for bleeding here in terms of prioritization. Now lastly, option 6, again, bleeding after brushing teeth. We're thinking low platelets. So anytime you guys get a chemo drug, just think the newest cells are killed off first, because the chemo is trying to kill off all the highly replicated cells. So really just kill off the cancer, and the fastest cells in the body are really the RBCs, the red blood cells. So it kills off those too. So just watch it. Okay, that wraps it up. For more details and test tips, now using our 3 steps, let's break this down. This question is asking for which indicative finding is for the key problem, too much methadone. So the memory trick we use for methadone is that done slowed everything down. So guys, it's a narcotic. It's going to cause your patient to be sedated and eventually go into respiratory depression. So the solution we're looking for are indicators to the patient that the medication is getting way too toxic. It's basically done slowing everything down. So option number 1 is correct. Sedation is a big indicator of toxicity. So remember, it's done slowing everything down with methadone. So option number 2 is incorrect. Normal heart rate, there's nothing slowed down here. Now, if it was bradycardic, then it would be a toxicity thing, or basically too much methadone. So option 2 is incorrect. Now option 3, the key word here is prolonged. Guys, the QT intervals or anything really should not be prolonged. So it's correct because it indicates toxicity, this too much methadone. Now option number 4 is a little bit tricky, but it's incorrect here. So scratches on the arms and torso could indicate an allergic reaction, but it can also indicate a side effect from an opioid, just making the patient itchy. Now, option number 5 is correct with too much methadone. So nausea and vomiting is an indicator of toxicity. So remember, methadone, it don't slow everything down, and so everything is really prolonged. Okay, that wraps it up. For more details and